Hi everyone, welcome to another one of our Facebook Live videos and the first one that we've done in a little while. As I sort of said on the last video that I did last week with a bit of an update, a pre-recorded video, it has been a little while since I've appeared on camera and got to talk to everyone, and surprisingly a lot of people said that they would like me to do this more often and come back and do another Facebook Live video. So here we are, here we go. For those of you who haven't participated in one of these Facebook Live videos before that I might have done, essentially I'm here, I'm online, broadcasting live now. You should hopefully receive a notification to tell you that the broadcast is happening, or you can go to the MStranslate Facebook page and you would have found us there, watch the live stream. But the important part for you is that if you want to participate, you can at any stage, simply just by commenting below the video, asking questions, sharing your thoughts, giving your opinions, because part of this is hearing from members of the community as well about your experiences, and there'll be opportunities to share that stuff as well, just as Graham has done, setting the example for everyone else. If you're watching the video, you'll be able to see that Graham's commented. G'day Graham, it's great to have you on board. Thank you for joining us. So as Graham's done, all you have to do, comment below the video, and I'll be able to see those comments and I'll be able to respond to you as we go along. So I've got a list of things that I want to talk about, things that we've sort of featured recently that I thought are worth bringing up. Again, we've had a couple of questions submitted from people who couldn't join us tonight, but had some questions that they wanted to answer. So we'll be working through all of that. But really, the point of these Facebook Live events is to give you guys the power and to ask whatever questions that you have about MS research that I may or may not be able to answer. Obviously, if you ask a question that stumps me, that's certainly a possibility. It's a good opportunity then to develop future content once I go away and do the research and look into what's known in that area to be able to deliver the answers to those questions, because as we always do, the whole part of this is to develop content that's of interest to our community. So the questions and feedback that we get tonight, as well as being able to respond to hopefully a lot of them during this broadcast, also helps us to develop that content as we move forward. So Graham and anyone else that's watching, feel free to submit those questions as they come through, and we'll make sure that we get to them. One of the things that I do want to say straight off the bat is, obviously with these videos, we want to get as many people watching them and engaging and participating as possible. It's always difficult to know what the most appropriate time is to do these videos and when really suits everyone. So feel free to comment with that as well. If there are better times during the day or better days of the week that you think would work better for you to be able to participate, even if you're watching this on delay, so that the video will be recorded and published on the Facebook page directly after this, so you can watch it at any time. If you are watching it at a different time, let us know when might work. A weekend morning's better, a weekdays around lunchtime a better time. We can certainly try and be flexible with it, because obviously the point is to try and get as many of you involved as possible. So let us know with that as well. We seem to have quite a few people watching at the moment, so that's great. If you're just joining us, welcome. As I've said, submit any questions or comments or queries that you have in the comment section under the video. We'll get to as many of them as we can as we go through. Great sign that my voice is already starting to go about 2 minutes into the video, but don't worry, I have a lot of water ready to go to get me through it. So I will start just by responding to a couple of questions that we received online in advance of this. So if as you're listening to these, if you do have other comments and questions, feel free to submit them through, and we'll get to them as we go through. If you have any questions about the things that I'm saying as well, feel free to respond to those. So One of the first questions that we got was talking about the use of biotin in secondary progressive MS. And so you may or may not remember that a while ago now, I did a video interview with Dr. Frederick Siddell, who is running the MedDay Pharmaceutical, who was running the MedDay Pharmaceutical trials of MD1003, which is the high dose biotin compound being trialled in people with MS, and that feature can be found on our website, and I will try and link that through as we're going on. And I'll be trying to do both at the moment. For those of you who have participated in these before, you may know that Eric is often here with me, helping out by posting the links to things that I'm talking about under the video. Unfortunately, he's traveling at the moment and out of Wi-Fi range, but you can still say hello to him because I'm sure he will be watching this back when he does get connection. But I'll be trying to still do that as we're going through. So if you see me sort of working between the two, that's because I'm trying to post the links and stuff as we go along. So the story with biotin has been quite interesting, and it's progressed along the way. So in 2016, about September 2016, we got the first results of the biotin trial, which was done in a small number of people. A really small cohort, a really early trial, and it showed that in this cohort they did see some benefits to using the high dose biotin. That later that year then was expanded to a greater or a larger trial looking at people with progressive MS, and so in this they had I've got the paper open in front of me at the moment. There was about 60 people. About 100 people who were on the high-dose biotin with a combination of either secondary progressive or primary progressive MS, and then 51 people on placebo. And what they saw from this was that no one who took the placebo met the primary endpoint, which was a reduction in disability at 9 months, confirmed then at 12 months. And they did say that a small number of people who took the high-dose biotin did see some benefits, did meet that endpoint. So it was about 13 out of the 100-odd people did see some benefits from that. So while it certainly wasn't everyone, they did sort of conclude from this that it can be beneficial, but only in a small subset of people with progressive MS. And I think they were looking into exactly what about those people might have made them respond to the biotin when the other people didn't. And of those 13 people that did respond to the high dose biotin, 9 of those had secondary progressive MS, 4 had primary progressive MS. So that's sort of where the trials were at. And there have been other trials going around. These are the ones that have sort of gained the most traction. Interestingly, in December last year, they were going through looking at getting approval for this compound, this high-dose biotin compound, through the European Medicines Agency. However, they were told that the evidence wasn't strong enough at this point, and so they've withdrawn that application to try and get more evidence. There's no indication at the moment as to whether or not they'll be seeking to reapply for it, but the likelihood is that my guess is that they probably will be, but that process is still ongoing at the moment. The other part of that question was asking about is there any indication for people who are already using it, or whether doctors are supporting it. Now, obviously, I don't have a heap of information about that other than things that we've sort of been able to read online or heard from our community. I mean, I do know that from some members of the MStranslate community, there are certainly some who are taking biotin and have been encouraged to do so from their doctors or neurologists. and have reported anecdotally to be doing quite well with it. If you are someone in our community who's watching this video and has some experience with taking biotin, please feel free to share that below. We'd love to hear what your experiences are. And certainly I think there is some indication from things that have come up at conferences and from other stories that there is some buy-in for the use of biotin in the medical community. But again, if it's something that you've talked about with your neurologist or your healthcare professional, it'd be interesting to hear what they've told you as well. So any sort of thoughts on the biotin research side of things that you might have experience with and can add to that sort of research data that I've just shared, please feel free to send that through. As Graham is doing right now, he's just said that his wife's been on it for 12 months. Well, any information that you can provide in terms of her experience, Graham, would be fantastic. So as we sort of work through this, I'm just going to be in the background, just pulling up that interview with Frederick Siddell that we did. That's looking into that, and I will post that in the comments section now. For people to be able to go back and watch. So that's the interview that we did after that first trial. So if you're interested in watching that, the link is now there in the comments. So Graham said that they haven't noticed any benefits for the biotin. So, going into this and based on the trial results that we've seen so far, where I've said that they were very mixed, some people saw benefits, some people didn't. And with what we know from all other MS treatments is that the likelihood is that it may be mixed in terms of who does benefit from it, who doesn't benefit from it, understanding who will and who won't. We're probably not at that stage yet, but the more information that we get, hopefully we'll start to understand that a bit better. Welcome, Christy. Thank you for commenting. She's just said that her neurologist has just recommended biotin, so we're starting it next week. Well, certainly make sure that you stay in touch, and if you want to share your experiences with it, please we'd be happy to hear. All of this sort of stuff is really important to continue to put together the evidence, both from all of this research data, as well as anecdotal, and hearing how people are actually faring on it who are taking it. So I'll go to Graham submitted a question that I will get to as I scroll back up. So he was asking about medicinal cannabis and when it will be available. The medicinal cannabis question is difficult. I'm going to start with saying that, and it's not an easy question to answer in terms of when it will be available, because I think there's probably a lot of politics at play here that are obviously going to make it a little bit more difficult to predict when it's going to be available. So what we know so far, in terms of Victoria anyway, is that medicinal cannabis is currently available for children who have refractory epilepsy, and that's the only condition at the moment that's been approved for the use. What the protocol is in terms of that moving forward, when it will get expanded to include other conditions and what those conditions might be, or the process behind it, I'm not sure of at the moment. We have been in touch with the committee that deals with that to try and get them to provide some clarity, and we'd love them to come on board to MStranslate and provide some updates on exactly how that process works, because we know that it is certainly something that many people in our community are interested in. So, in terms of getting that information, I'm a little bit in the dark on it, but we are keen to know more, just like you are. I think it's in an interesting space at the moment, and it's probably a reasonable time to mention the recent study that gained a lot of mainstream media attention that looked at the use of cannabis and its effect on chronic pain. Now, I've done an article on this. I've done a summary on this research on the MStranslate website, which I will drop in the link under the comments section for anyone to read who may have missed it. So this, for anyone who may not have heard this, this received quite a bit of media attention because the conclusion of this 4-year study, and this was probably one of the longest studies that has been done on it, suggested that cannabis was not beneficial for chronic pain. I'll just pause for a second to say hi to Wendy and hi to Kathy who are joining us. Hi also to Nick. I have seen your question and I will respond to it shortly. Thank you everyone who's watching at the moment. Keep the questions coming. I will get to them all. Phone's charged. Got the night ahead of me, so I've got plenty of time here. So this got mainstream media attention because of this outcome saying that cannabis. Hi Kate. That cannabis wasn't effective in managing chronic pain. Now, as you will see if you go through and read the summary that I've written, I think that there were, my personal opinion, was that there were quite a few limitations to that study in terms of how it was performed that probably didn't justify the conclusions that were certainly being reported in the media. Now, what's I think is also important to mention is that the conclusions that were reported in the media didn't necessarily line up with the conclusions that the researchers themselves reported. So they were a little bit more guarded in how they read it, and said that realistically what they thought the outcomes was that if medicinal cannabis or cannabis is going to be used for the management of pain moving forward, that more research needs to be done on it, because the perception that it was effective may not have mirrored up with what they saw in their study. Now, one of the biggest things that I will say about that study was that this wasn't looking at medicinal cannabis. This was purely following people who were recruited for the study because they had chronic pain and were being prescribed opioids for that pain. And they looked into this cohort of people and asked them if they had been using cannabis. So for the most part, this would be cannabis that they were accessing really from buying off the street. So this isn't the pure synthesized compounds that we talk about when we look at clinical trial results or trial results for this in other studies that we've looked at. So I think that that's going to provide a really big limitation in terms of the conclusions that you could draw from it, because obviously there's lots of different things that people might be buying that might have all different sorts of effects. Different strains are going to have different efficacy and things like that. Also, they were sort of monitoring people at the end of each year across these 4 years, and so trying to get a really clear picture on what their pain management was like across that time is obviously difficult using that sort of system. So, definitely I would encourage people to read that summary. If you haven't already, I'm happy to take any feedback that you might have on it. Obviously, with the new summary formats that I've been using, people seem to have responded positively to those. Hopefully you like how I'm doing it now in terms of breaking down the background in terms of facts. So giving a bit of background and introduction into where this research is coming from. Then just sort of summarizing the findings in some really clear and concise sentences, and then providing some thoughts at the end of it. Now, often those thoughts are my own. If they're talking about limitations, they may have been mentioned in the study. They may be mine, obviously, in talking about when we're looking at animal studies or things like that, stressing the importance of understanding that these have been done in an animal model. So, we still have to wait to see whether or not they translate, trying to put all of that stuff into context. So there's a mixture of things in there So obviously, if you want to disagree with any of my thoughts on these studies, feel free. I like commenting. I like having conversations about these things. I'm certainly not here thinking that I know everything about everything. I come to it from my point of view and give it to you with the science background that I have. But certainly I'm happy to engage in any conversation about that, either during these videos or when we post these articles. Hi Maria, thanks for joining us. If you're just joining us, if you haven't participated in one of these before, and I can see that we have lots of people watching, which is fantastic. Hello to all of you. If you haven't watched one of these before, essentially it's me coming online and talking non-stop, but it's really to answer your questions and to engage with you, our MStranslate community, and talk about the things that you want to talk about. So if you do have any comments, topics that you want to know more about, questions that you might have, all you have to do is drop them in the comments section below the video. I can see all those as they come up, and so I can respond to them as they're there, and I will do, and we have a number of things to talk about. So if you do comment and you don't think that I've seen it, I will have seen it. I will get around to responding to everything before I go offline. We just have to, I'll be working through a list of these things. So Kathy's just said, yes, but your thoughts are definitely considered and with a decent background, unlike a lot of media. Well, thank you. I do appreciate that. I mean, I certainly, it's fair to say that everything that I comment on is certainly done from an independent, balanced way. And so I think that's, and trying to always provide it in a context. One of the biggest things that we want to try and avoid is hype, because what I don't think necessarily is understood in the media is just how much of an impact these articles can have on people. And I feel really fortunate now through what I do through MStranslate, is that I get to talk to you guys through these sorts of things, but also to go out in person and talk at MS groups and to talk at conferences and things that I've been really lucky to have the opportunity to do. And it means that I have a new perspective now that certainly keeps growing about the interest levels of the MS community with this research, but also the effect that the reporting of this research can have. And there is there's people's lives. It's your lives when you're reading these things and you hear this. It can have a positive or a negative impact. I mean, obviously, this saying that cannabis doesn't benefit chronic pain. You read that, and that might be depressing. That might be disappointing. If you're someone that was hoping that this might come around and help with that, and we know that might not necessarily be the case. There's a lot to go before we can make that conclusion. And trials and studies from MS have shown something different. On the other hand, we have ones that can do the opposite, and this is probably a good opportunity to talk about another study or journal article that was recently published that also got mainstream media attention, where it said that the cause of MS had been identified, and talked about cause of MS identified. It's caused by a series of infections, which means now we should just be able to develop a vaccine to these infections. MS is cured. Now, again, I've written a summary on this on the MStranslate website, and I'll drop the link to that in a second underneath. But that journal article that was published, really importantly, was purely a theory. A couple of researchers had gone and done some really impressive background research, looking at a lot of epidemiological data that had been previously published, pieced that all together and come up with a story that they thought fitted with all of this data that had been previously published. Now, they haven't gone and researched that theory yet. They haven't looked in to see whether or not the theory is true and gone and tested it. They did say in the journal article that they thought the theory was able to be tested, which is a good sign that they can actually go away and actually now see whether they can prove or disprove their theory. But they hadn't done anything. So to say that they'd identified that subsequent infections were the cause of MS, and that we were, just around the corner from creating a vaccine that could potentially cure MS, it was really inaccurate. And that's the sort of story on the flip side of the cannabis story, that if you're reading that and you don't have sources that can sort of give you a different perspective on these things, that have gone and read the research article directly, can do the opposite and can get you create that sense of false hope. And so it's finding that balance that we're trying to do a lot of. And it's not just us. I don't want to sit here and say that we're the only ones that are out there providing accurate information about research. Other people certainly jumped on this story and also provided a bit more context with it. Sorry, I'm just posting the link to that article as we do this through the course of MS. It is important, and I said that I commented under this that I feel like a broken record at the moment because I'm constantly talking about inaccuracies in the media and how we need to be really careful about the things that we read, so that we can make sure that we are finding that balanced approach and that we know exactly what's going on. But it is really important. So I'm not going to try and not harp on that. I think those were the two that I wanted to talk about in terms of media representation of these things. So, but again, if you've read other things, there's certainly other examples. If you've heard me talk at an MS group before, as I know a lot of you have, I will have given other examples of this in the past. But if you've seen other things in the media, they could be right, they could be wrong. Drop them with us. One of the points that I wanted to make about that was, we're happy to be that resource. If you do see something in the media and you're not sure, do I believe this? Do I not? What's the reality of it? That's what we're here for. So drop it on our Facebook wall. Send me an email. Send us a private message on Facebook. You can drop it to us on Twitter. Any of that sort of stuff. We're happy to do that, because if you're seeing it and you're questioning it, the likelihood is there's probably a lot of other people in the MS community that are also doing the same thing. So it's important that you have that. And that you can drop it through. So certainly do that. Welcome to everyone watching. We've got a few new people watching. I can see that the numbers are really growing at the moment. So welcome everyone. Just again, if you haven't joined one of these before, I'm here to answer any of your questions about multiple sclerosis, and in particular multiple sclerosis research. So feel free. Drop them in the comments below, and I will get around to responding to all of them as we go through. So I'm just going to scroll back. So actually, I can do it on here. So Nick, welcome Nick. As I bring up your question on my computer as we work through it. As I keep trying to get through to it on here. So Nick asked, I'm just learning about the Wheldon protocol. I think I was confusing it with the Wiles protocol. I saw a promising clinical trial and I was wondering if anyone has any more info. So one thing I will say, Nick, is that I know that there are members of our community that will be able to provide you with a lot of information on the Wheldon protocol. And they certainly probably have done a bit more reading about it than me. It's certainly something that I know a little bit about and can talk a little bit about it with you. And if there's interest, what I will say with this is that I can go and put together a summary of exactly what it is and what's been shown so far with it. And we can post that to the MStranslate website over the coming weeks, so that you can see more about it. It certainly is different to the Wiles protocol. And so the Wiles protocol is a diet lifestyle protocol. And for anyone who was sort of following MStranslate recently, you will have seen that I did a two-part interview with Dr. Terry Wiles that's been published on our YouTube channel. And again, I'll drop the links to that below the video in a few minutes when I get a bit of a chance. But the Wheldon protocol is more looking at treating chlamydia and pneumoniae as a way of treating MS. So there is certainly some indications that if I take this back a little bit, what we know about MS is that there is a genetic component to MS, but we know that MS isn't a genetic disease. So there are environmental factors that play a role in the development of MS. We don't know exactly what those environmental factors are yet, but we do have there are some suggestions and there are some hints, and one of the suggestions that comes up quite a bit is to do with infection. So a variety of infections have been implicated. Probably the one that you might have heard the most about is Epstein-Barr virus, or EBV, which is the virus that causes glandular fever. And that's been linked or associated with MS for a long time. The difficulty with EBV is that a lot of people have been infected with EBV. While not a lot of people have had glandular fever, a lot of people can get infected with the virus without developing any of the symptoms or getting sick. And so the numbers of that are it's roughly, and I haven't seen the recent numbers on it, but it's previously been around sort of 93 to 95% of people with MS have had a previous infection with EBV, where it's sort of 85 to 90% of the general population. So we're already dealing with really high numbers of the population have come into contact. So that always makes it difficult to work out what that association is. And so, yeah, Kathy's saying 95%. Yeah, so it's really high numbers of the general population, and that makes it really hard to work out just from that whether or not there's an association. It's likely that if there is an infection, it's got to be in sort of a perfect storm sort of way, where the infection itself isn't enough. You know, the infection combined with some other genetic factors, combined possibly with some other environmental factors that all come together to create this perfect storm. There is other evidence regarding how EBV might be involved, and again, I've posted summaries of that before, and I will post the link to that as we go on or after I finish the video. But yeah, so the Wheldon protocol is looking at using a combination of antibiotics to treat this chlamydia pneumonia infection. There is some evidence behind it to suggest that it may be effective, but yeah, as I said, that's the basis of it. I would need to go back and really review the published literature, the most recent published literature on it, to give you some really good information exactly in terms of what studies have shown with it, because it's been a while since I've looked at them, and I don't want to sit here and sort of give information without being completely accurate on it. Obviously, that's important with what I've just been saying. So that's sort of the background as to what it is. And yeah, I will go away and I will write a summary on it, post that to MStranslate, and hopefully that will help answer your question in a bit more detail. So as we keep going through, I'm just going to post the links to the Terry Wiles interview for those people who may want it, who might not have seen it. And then I will get to the next question. So the next question, which has just been posted, as we do, so there's the Terry Wiles interviews for anyone that wanted those. So as I scroll back up, just making sure I haven't missed any questions. So Wendy has just asked a question. Thoughts on HSCT, and will it ever be available as a treatment option in Australia? I believe there has been some trials, so many people heading overseas for treatment. It's an excellent question, Wendy. So it's a difficult question to answer, again, similar to when will medicinal cannabis be available in Australia, just because there's so many different factors involved in this that aren't necessarily things that I'm aware of behind the scenes. What I will say is that I think certainly more and more evidence is coming out that HSCT can be a very effective treatment option for some people with MS. Similarly to other treatments, it doesn't work for everyone. And we've done, hi Anna, welcome. We've done video interviews with members of our community, someone who didn't receive any benefits from the treatment, someone who did receive huge benefits from the treatment. So I think, yeah, as I said, the more and more that we go on, the more we are seeing that it can be a really effective option and can be a really long-term treatment option for some people in terms of benefits lasting for now, with quite a time having elapsed since some of the trials started, that some people, have responded having really big benefits out to 7 or 8 years. So, will it be available here? Personal opinion, because again, I don't know. I think yes. Again, it's always just about coming up and getting to a stage where enough evidence has been generated to get to that level of approval, and one that I will talk about. Another question that we received prior to the broadcast was talking about cladribine or Mavenclad, and I will talk about that because it's in a similar sort of boat. But yeah, I think it will be. I think that we're always looking to provide as many treatment options as possible. And so I think as this continues to prove that it could be useful, I think that it might become available. Yes, there are trials going on at the moment in Australia, and the biggest one is happening in Sydney. And last year we were able to participate in the MS Research Australia Progress in Research conference, and one of the Facebook Live interviews that we did while we were up there was around that trial, and I will find the YouTube link to that video and put it through so that you can watch that as well. I think it was posted to YouTube, but was certainly on the MS Research Australia Facebook page, but I will check here. So you can, if you scroll through their videos, you will see it. But I think that it was also available on the YouTube channel, but I will look and find that, because that provides a bit more background about their study doing it. I guess one of the important things, and again, this comes back to having appropriate information, is just that people are really aware of what HSCT is, because certainly early days, and this was a few years ago now, there was quite a bit of misconception about what the treatment was. And I think that we've done, not just MStranslate, but lots of people have done a good job of starting to change that misconception. So that people are now really aware that it's chemotherapy to wipe out, sometimes radiation, to wipe out the bone marrow, wipe out the existing B and T cells, and then to replace those with the person's own bone marrow. So essentially you get a bone marrow transplant. That's the T part of it, to then reset your immune system. So the whole point of this being that if the immune system's what's causing the damage in multiple sclerosis, let's get rid of it and start from scratch and reset it. Now, the reason it can be effective is that we're resetting it back to what I like to call its baby phase, before it knew that it should, or it got triggered to start attacking the myelin, to start attacking the central nervous system. Now, the reason why I don't think this is a cure, and it's been reported as a cure before, and I don't think it's a cure, my stance is that it can be a really effective therapy for some people. The reason why I don't think it's a cure is because we're putting those same cells back in, and even though we're putting them back in that naive stage before they got that trigger, they're the same cells that could go and do that again. And so if they encounter the same trigger, which we don't know what it is, theoretically, the disease could come back and start attacking it again. As well as that, there's nothing about this treatment that repairs that damage that already exists. It can stop new damage, and it can stop that really effectively, but it's not the repair, and that's sort of the next stage of treatments that we're looking at when we talk about remyelination. So, yeah, I think hopefully that answers your question a bit, Wendy. I do think we will see it. Trials are ongoing. We're getting more evidence, but it's just getting to that point where, you know, we do have enough evidence where people are happy to go, yes, okay, let's do this, because we need to be in a situation where we can have a really good conversation about it, and I think we are at that point now. Because as you say, a lot of people are travelling overseas for it. It's obviously really expensive, and we constantly see stories about people trying to raise money to go and get this treatment done. But as well as that, the unfortunate reality with this story is that there have been a lot of instances of clinics that probably aren't reputable, for want of a better word, taking advantage of people who are desperate and in their situations and not really providing treatment or a good treatment. So people are spending lots of money and not getting what they expect. And so we really need to guard against that. So welcome, Cassie. Thank you for joining us. So which patients could not have HSCT? So it's not that patients can't have it. Obviously, it can be quite a serious treatment option. You know, the chemotherapy can be very intense. Obviously, there's a period after where you're very susceptible to infections. Certainly, as more trials are ongoing, that actual chemotherapy or conditioning protocol, as it's called, the chemo and the radiation, is being adjusted, so it's not necessarily as harsh as it once was, and different studies using slightly different treatments to see, you know, what sort of lower level of chemotherapy can you get away with so that you reduce the side effects and the danger, the risk, while still getting the benefits. So there is obviously that to it, and so that needs to be taken into account. What I would say in terms of the results is that it's similar to other treatments. Some people will benefit, some people won't. There's certainly been discussion that the people who will benefit the most or are the most likely to benefit are people who are relatively early in the disease, who have really highly active, highly inflammatory disease. They seem to be the ones who will benefit the most. I think there's been some suggestion that progressive won't benefit as well, and that may make sense with what we think is happening in progressive MS, in terms of maybe a shift in terms of what's causing the disease between inflammation versus neurodegeneration. And so this will help with the inflammation part, but maybe not the degeneration part. But I think there's still been evidence that some people with progressive can benefit. So, you know, we have some general guidelines, but they're not perfect yet. Would be my sort of answer to that. So it's, you know, it's not to say that if you've had it for a long time, as you're saying that you do, it's not to say that it wouldn't work. It's just these are sort of our best guesses at the moment in terms of if we had to, you know, say the odds are good or the odds aren't good. That's sort of where the evidence is pointing at the moment. But as with all of the other treatments that we say, you know, some people will respond to them, some people won't. So what's the difference between... so Wendy's just followed up comment. And sorry, I did just see another question. Graham, I've seen your question. I will come to that in a second. I've got a couple of different things that I want to talk about as well around all of this, but we'll keep working through them all for people who have just started watching. If you're new to this, essentially we're just discussing MS research. Anything that you want to discuss, drop the comments below, and I'll respond to them when I can. But we'll essentially be continuing on until we run out of battery or it gets a bit too late and we need to stop. But we've got heaps of time left. So yeah, in terms of Lemtrada or alemtuzumab, as it's known, similar sort of thing in terms of it's about dealing with these cells that are causing the damage, and a lot of the MS treatments all sort of work in this way. I mean, all of the treatments that we have at the moment really are about depleting cells in the immune system or modifying them in the way they work or restricting our access to certain parts of the body and things like that. So they all work in slightly different ways, but all in the same sort of mechanism. Part of it is obviously in terms of how complete it is. So obviously using chemotherapy or radiation to completely wipe it out, that's really going to deplete the cells effectively. Bit more harsher. So that sort of, they're all around that. I can certainly write an article that explains, I mean, we haven't really talked too much about Lemtrada. It's one of the ones that I haven't, of all of the treatments, probably the ones that I feel like I've talked about the least on MStranslate. So again, if there's an interest in knowing more about it, certainly something that I can write a summary on and put up to MStranslate over the coming weeks as well. There is, although I was worried about it a couple of minutes in, Kathy, there is absolutely no worries that I will run out of voice. Having watched Carlton on a number of occasions this year, as I mentioned the last time that I talked to your group, I get quite a lot of practice at yelling and shouting and talking a lot. So it's good. It's a good rehearsal for when I come on here and do these. So I promise that the voice will hold out. Plenty of water here, so we should be fine. So continuing through all of the different questions, I will just stop at the moment just to, I somehow managed to bring up Carlton in every Facebook Live video. I wish they're not endorsing it. Carlton, if the Carlton Football Club is watching this, MStranslate would love your support for what we do. So feel free to do that. It's my little pitch for the evening. So in terms of talking about whether HSCT will be here as a treatment, I guess one of the other questions that we had was talking about cladribine or, yeah, probably accurate, Graham, whether cladribine will be approved under the PBS. So cladribine or Mavenclad, again, is another MS treatment or treatment that's been used in MS in trials that's been shown to be effective. It again works on these cells in the immune system. It reduces the T cells and the B cells, which are known to play a role in causing the damage in multiple sclerosis. In terms of how it compares to the other treatments, there's been no studies done yet that have actually directly compared them with anything else. But MSBase, which is a big clinical database, which we featured another study from yesterday in one of our videos, and if you haven't watched that video yet, I really recommend that you do, especially if you've got primary progressive MS. We don't see a lot of research coming out about that, and this was very interesting and potentially really important in terms of regulatory guidelines, which is what we're talking about here. So you can watch that. Just scroll back on the Facebook page to watch that. But what they did was they were able to look, not in a clinical trial setting, but just look at real-world outcomes for people who were taking it, and they found that compared with fingolimod or Gilenya, that there were relatively similar, or what looked like similar effects between those treatments and similar side effects. So cladribine, similar side effects to what we see with other MS treatments in terms of increased risk of infection, headaches. Again, there had been an indication from earlier trials that potentially an increased cancer risk. Later trials have shown that they're probably similar in terms of, again, how they compare to other MS treatments in terms of that increased risk. In terms of whether or not it will be approved by the PBS, it's been rejected twice. Most recently, in around April this year, it was rejected from being included on the PBS because basically, what they looked at and decided was that they didn't think that its effectiveness compared to other treatments that were available was that much better, that it almost more cost effective, that it was worth including. Now, certainly because we know, especially when it comes to multiple sclerosis, that it's really hard to say that a drug or a treatment isn't more effective, so we shouldn't make it available, because we know that individuals, when we talk about this on an individual level and from a personalized perspective, on a whole it may not be more effective, but for a certain person they may not respond to this treatment, and so they need more options to find one that they may respond to. So, I think people are going to continue pushing for this to be included. There are certainly studies that are ongoing. A couple of studies that I've seen really recently coming out from the UK have sort of delved deeper into the clinical trial data for cladribine and showed, especially in people with high disease activity, it seems to be particularly effective. And certainly a new study that I need to read in depth, but has looked at the cost effectiveness in a UK model for the NHS and supported its use there. How much that translates across to the Australian setting, we don't know, but I think people will be pushing to continue to do more evidence to generate whatever evidence is required to get to the level where it is approved here. I think MS organisations in Australia will continue to try and push for it to be included. So that's where we're at. For the people who asked about cladribine, that's sort of the state of play with that at the moment. Does it also affect the liver? I'd have to go back and look at the clinical trial data to be able to answer that specifically in terms of what they saw in terms of liver side effects. I can't remember off the top of my head, but I can certainly look into that and respond to that. Often a lot of treatments will, because they get processed through the liver, so there's often some liver effects that can be seen, but I can't remember off the top of my head in terms of specific ones that may have been seen for cladribine that haven't been seen in other ones, but I will look into that more for you. So just scrolling back up. So Graham's asked another question. What's your feedback on ocrelizumab outcomes so far? That's an excellent question, Graham, and to be honest, there's not a lot I can say because I haven't heard too much. In fact, people in our community may be in a much better position to answer this than me, because I haven't seen too much about post-clinical trial data, any real-world outcomes on it yet. It's probably almost too soon to be getting that. I would expect that we would start to be seeing that. I haven't specifically looked, but it hasn't come across my reading so far, which doesn't mean it doesn't exist necessarily, but I think we would be seeing it more if it had. Happy to be proven wrong on that. But yeah, I haven't seen too much in terms of how it's been working in these real world settings. We do know obviously that clinical trials are sort of best case scenarios with hand-picked participants. That doesn't necessarily lead to the same sort of results in once it gets approved and released. So I'm happy to hear from anyone who might be watching at the moment that may have some experience with ocrelizumab, who has been taking it, to see how it has been going. Again, in terms of approval, it hasn't been approved for PPMS here. It will be interesting to see if it is. The trial data for that, as I think I've said before, it was exciting because it was the first one to really show anything for PPMS, but it was a very small benefit. So I think that sort of got lost a bit in first treatment to show an effect for PPMS. It was quite small. So whether or not that will get approved, we wait to see in terms of what real world data follow up trial data. I'm waiting to see it as well. But yeah, as I said, if anyone's watching and has some experiences with this that they'd like to send through, that would be great. I'd be happy to hear your comments on it. So sorry, just seeing plenty of verbatim on the Ocrelizumab for Australia MS group. Or happy James, if you want to sort of send or share any of those comments. I'm obviously happy to go and have a look after this. It's hard I'm trying to multitask a heap of different things at the moment. But yeah, if you want to share through any of that sort of stuff, that would be great. And Graham, feedback, some positive feedback for people now on their second 6-monthly infusion. I certainly think the trial data was quite good in terms of relapsing, remitting MS. If that's where the positive feedback's coming, that's great. Again, I really think that this is all about providing as many different options as possible. As I said, we know that not every treatment's going to work for every person. So the more different treatment options that are available, the more choice people have. And obviously with different levels of side effects, people can choose the one that best suits them in terms of the stage of the life they might be at, what their priorities are, and things like that. So, it will be interesting to hear more and more as it comes out. But it's good to hear that there's been some positive feedback so far. That's great to hear. In terms of that, while we talk about, seeing as we're talking about while we talk about primary progressive MS and treatment options for it, I've already mentioned that we did a video yesterday with Thomas Kalinchik, Associate Professor Thomas Kalinchik, who's the head of the Clinical Outcomes Research Unit, or CORE, at the Melbourne Brain Centre, at the Royal Melbourne Hospital here, associated with the University of Melbourne. And he was talking about a study that they've just published that's found some really interesting information in terms of people with primary progressive MS and treatments. So what they found through looking at the clinical data in MS Base, which we mentioned before as well, is that, interestingly, there is quite a few people who are primary progressive who are taking currently available treatments that are often just seen as relapsing remitting treatments. And what they found was that in people with primary progressive MS that didn't also experience relapses, these treatments had essentially no effect. They weren't getting any benefits out of it when they looked across time at progression of disability or disability accrual. However, in the people with primary progressive MS that did have relapses or experienced relapses throughout that course, who were taking treatments, they found that those treatments were able to reduce their risk of disability progression or disability accrual. Now, I won't go into the specific details of that, but that video is on our Facebook page under this, so you can watch it. It's also available on our website as of today, so I will post the link to that as we go through as well, so that you can have a look at that. I really suggest watching it. It's really important, and the important thing, going back to talking about regulations, is that at the end of that video, Thomas mentions that this study and this published article now will hopefully provide evidence that they can take to regulators to say these treatments should be available or put on things like the PBS for people with primary progressive MS with relapses, because they do get benefits out of it. So currently they're not, but hopefully this evidence might lead to them being available to let them be able to do that. So there is that. So for people interested in that video, I know that we've certainly had calls before for people to or to get more information out about primary progressive and secondary progressive MS. So that is some really interesting research that you can watch. So just going through some of the other comments here. So Nick says, I'm on Ocrelizumab myself, and I'm in a few Facebook groups for people. And there are a lot of people with a lot of great info. Just search for Ocrelizumab groups on social media. Graham says, Facebook support group for Ocrelizumab going now with heaps of commentary. So that's fantastic. Certainly if anyone who is on there, Nick, yourself, or if anyone else, would be really interested in talking more, and if you want to share your experience with it. One of the things that we do through MStranslate is we want to share personal stories and experiences. It would be great to share the experience of someone who's one of the early people to have gained access to Ocrelizumab and be on it. So if you are interested in sharing that experience with people, you can send us a message on here, or send us a private message, and I'll get in touch with you after this. It can be written, it can be an audio, it can be a video, depending on where you are. We have lots of different formats to do that, but it's certainly, obviously, people are interested. It would be really valuable information for the community. So that's certainly something that we'd be interested in doing. If there's anyone out there, either yourself or other members of this group, if you want to promote MStranslate in those groups and say, look, we'd be interested in hearing from you. Obviously, the more people that come across and follow MStranslate, they get access to our information, but also, the more voices that we have contributing to discussions like these, the better it is. So certainly do that. We'd be happy to hear from them. So there's a lot of stuff that we've been talking about, a lot of different information. We have lots of people currently watching, so if you are currently watching, please feel free to drop questions or comments. All you have to do is just post them in the comments section below the video, and they will appear on my screen, and I will answer them. It can be anything. It can be research that you've seen, topics that you want to know more about, feedback on things that MStranslate's doing or not doing, things that we could be doing better. Anything at all. Contribute to the conversation. I'd love to hear from as many people as possible. It's great to be able to see some new names popping up here and some familiar names, people who have seen me do these before or had me come to group meetings to give the presentations know that this is the part of what I do that I really love doing. I love being able to interact with you guys. I always find it really exciting to be able to do it. So, I would love to hear from as many of you as possible. Even just say hello. It's nice to know how everyone is and where they're from, and it's great to have this community. And I am biased, but I think the MStranslate community is one of the best in the world. You guys are fantastic. And I would take this opportunity to thank you for all your ongoing support, but also all of the engagement that we've been getting recently on all of our posts, in terms of comments, in terms of likes, in terms of shares. All of that stuff is really important, because the feedback tells us whether what we're doing is important and interesting to you guys. It tells us that the information that you're getting is information that you want to be getting. It's important that it continues to spread the word, because for us, obviously one of the most important things for us to be able to keep doing this and keep providing as much information as we can is that we get out to as many people as possible. So the more people that we know, the more people that know about us and can come and like the page, share the MStranslate resource with people. That's really beneficial for us. People often ask, what can we be doing to support you guys? And that's the biggest thing. It's just, be active, comment on our posts, share them, like them. Visit the MStranslate Facebook page directly as often as you can, because our articles don't always pop up in your news feeds. All of that stuff is really helpful, but you always are incredible. But especially recently, the engagement that we've been getting is fantastic. And as I've said before, to some people in our community, it's really touching. It is, really sometimes overwhelming to hear the support that we get from you guys, and how much you appreciate it. And as a small little story in terms of, how small the world is, heading back here to do this Facebook Live video tonight, jumped in an Uber. I was chatting about what I was coming home to do, and lo and behold, Uber driver turns to me and says, I actually have MS. And so we start talking about that. So I did my own little Facebook Live broadcast in an Uber Live and said, go for it. I'm going to do this later on tonight anyway. Ask me any questions that you have that you want to know about. So we had, a bit of a Q&A session in an Uber as we were driving along. And obviously at the end of it, he was, hugely appreciative. And it's, that stuff it's why we do it. It's, don't do it for the positive feedback, but it's nice to know that it makes a difference. So that sort of stuff is really important. So thank you. I just wanted to take the opportunity to say thank you for that, because it's, it really does mean a lot. I won't keep going with that, but it really does mean a lot to myself and to Eric, in terms of what we're doing. So, thank you. In short, thank you. So just as I've been doing that, I've noticed a bunch of comments coming through. So I'll just go back through those. Hi Marta, welcome. Thank you for watching. Thank you for commenting. It's great to have you on board. It's great to know you're watching. And no need to thank me for the time. As I said, I love doing this. I find this, this is a highlight of my time. When I get to do this, I get to talk to you guys. I would do this all the time if I could. If anyone's watching and wants me to come and talk at group meetings in person, let me know. I love doing that as well. Always happy to do it. Always happy to find the time. Hopefully people have had me done it before can, provide some comments to say that I'm not unbearable in person, and it's worth getting me along to do these things. So, happy to do that for anyone. But Marta, no worries. Thank you for participating. And same to you, Emma. Hope that you're enjoying watching from Sydney. Probably getting a bit better weather up there than we're getting in Melbourne at the moment. But again, thank you for all your contributions. I know that you often do engage with our posts. And so, thank you for that. So now just going back to Cassie, I just wanted to share my very recent experience. Some levels were elevating and I was AMA positive. Then I had to have a liver biopsy 2 months ago. I don't have the primary biliary cirrhosis that was first thought. My past 2 blood tests were AMA negative, so the liver doc said it was a waste of time having that biopsy. So was that on a specific treatment that was coming up, Cassie, that you were saying that? It is important at this point for people who may not know this, who may be new to MStranslate or haven't seen me do these before. My background is purely a research background. I'm not a clinician, I'm not a neurologist, purely science, purely research. So in terms of any sort of clinical things, if it's stuff that's been published in research journals in terms of scientific studies that have been done, happy to comment on that. I can't comment on anything clinical just because I don't have that expertise and I don't want to, talk about things that I don't know enough about. And saying that, happy for you to share your experiences because there may be other people in our community that can comment with their experiences and may have things that they can share in terms of if they've been through something similar or can give you some comments on that. It was on Galenia. Okay. Cassie, if you'd love to go to a group meeting. So we don't, currently, MStranslate don't organise any group meetings. If anyone's, I'm going to throw this out there. Would anyone be interested in attending a meeting/conference that MStranslate organised? I'm just going to put that out there. Idea that I've just had. If we were to organise something, would you be interested in coming along, participating online as we did it? If it was an in-person event /online, is that something that you would be interested in? Discuss. So there's lots coming through at the moment. that I'm just working all my way through. Bear with me for the moment. Kathy, can you show us your award? I can. I'll do that right at the end because I'll need to. It's not here. It's in my room. I need to get it. But let me look for that a bit later, and I will do so. But at the moment, let me try and get through all of this. Scrolling back through. So just to go back to the Ocrelizumab, James, surprised to read regenerative stories from people on Ocrelizumab, like feeling back in toes after 13 years of numbness. Does this align with your expectations? Yes and no. There was some indication from the clinical trial data that not only could it slow, but it could reverse somewhat. That was certainly, there was an indication. Now, I'm sort of working off memory here without having the data in front of me. I know that there was hints of that. I think it was minor hints of it. It certainly wasn't a dramatic reversal, but there was some hint that potentially there might be, some sort of repair, regenerative stuff going on. In the primary progressive, they sort of hinted that as well. But hint, so it doesn't, I'm not completely taken aback by it, but I certainly don't think it's something that necessarily everyone on it is going to experience. But I'd have to go back and exactly look at the data to see exactly how convincing it was when I'm looking at the figures and the graphs in front of me to comment too much further on it. But yes, there was hints. That is my easiest answer to that. Yes, there was some hints to it. Okay, so lots of positive comments about us organising an event. So keep that in mind. Keep bugging me on it. Put it on my to-do list. Let's see what we can do in that space. Just scrolling back up to Kylie's question. Thank you, Kylie. Kylie is someone who's regularly participates in these events. Thank you for all of your support, Kylie. It's great to have you on board again. Glad to have you here. So I'll just read through. So interested in finding out the efficacy of DMTs in people over 50 years old. I've read somewhere that after 50 they're not effective. I'm 49 and my first symptom was at 45 and haven't started meds yet. Thank you for your time and effort you put into MStranslate. You really do make a difference in our lives. Thank you for the second comment. As I said, that's hugely appreciated, hugely touching. I'm not going to talk too much about that so I don't get too emotional. If you watched, as Kathy mentioned, the Seeing MS Awards that we got earlier this year, when I made my little speech when we got that, I got quite emotional in that about you guys and the community and really what you do for us. So if I talk too much about it, I'll get a bit too emotional. So thank you. It does mean a lot. I'm going to give you my brief, honest answer to that question, and then I'll give you some thoughts on it, which is just opinions in terms of what I'm thinking. I haven't seen anything specifically around that says, in terms of an age, people reach an age where these DMTs are no longer effective. My likely thoughts, so that's my first comment. I haven't seen anything that says that. I haven't read that article. My guess as to where that comment might be coming from, or that thought might be coming from, is that if we think that most people get diagnosed with MS between 20 and 40, roughly, and a significant proportion, or sort of 50%, will go from that to secondary progressive MS within 10 years. Now, that figure is a little old. That could be less now with some of the new advances in treatments and things like that. But my thought is probably where that comment's come from is by a certain age, a lot of people might have shifted from relapsing remitting MS to progressive MS. And the thought has always been that these treatments are effective for relapsing remitting MS, not so effective in progressive MS. Now, I think the more and more we're seeing, the more we're finding that that's not always necessarily true. And again, going back to Thomas's research, Thomas found some stuff a while back that suggested treatments can slow the progression from an EDSS, which is a way that clinicians use to measure disability. It's a disability score in people with MS. From 6 to 6.5, which is an important step in terms of quality of life, because my understanding is you go from needing a walking aid in one hand to needing a walking aid in both hands. So obviously, then you don't have a free hand to be able to do stuff with. That treatments were effective at this point, and there sort of had been this theory that at that point the treatments weren't going to be effective because at that point you're probably in the progressive stage. So. Yeah, that's sort of my thoughts on that sort of idea that at this certain age, beyond 50, that the treatments aren't effective. My guess is that it's coming from shifted to a more progressive form by that stage, and that these treatments aren't effective in progressive. And both of those not necessarily true, but that's sort of my thoughts. I will look into it to see if I can find anything more concrete. Those are my thoughts on it for now in terms of what I think. So hi Leanne, thank you for your comment. And Leanne, again, someone who often comments on MStranslate, and we've interacted a lot in the past, so again, thank you for all of your support. Research about effects of lesions on the brainstem. So yeah, I've been certainly looking into one of the questions that we get quite a bit, and I think you and I might have discussed it previously, is in terms of effective lesion location with symptoms, disability, and things like that. In terms of the brainstem, I know I did look into it. And off the top of my head, I can't remember. Again, I'll make a note of it and remind me to. I'll make a note of it and make sure that I publish. I've got the information somewhere here, so I will look to publish something on that in terms of what I know. I don't think I could find too much. Is my short answer to it. But again, I need to look back through my notes on it. To find exactly what I did have. The idea of number of lesions, lesion location is still, I don't know if controversial is the right way of wording it, but certainly something that we're still trying to get a grasp on, in terms of really working out, is it how many lesions you have versus where they are that's more important. There was recent research that looked at saying that lesions disappearing is actually what's important. So looking at lesion disintegration as a way of being able to measure the effectiveness of treatments, because instead of looking at new lesions appearing, looking at if they're actually disintegrating, it could be a more effective way of measuring progression and getting an idea as to whether or not people were responding to treatments and things like that. Lesions in brainstem, I've looked. Yeah, I'll go back to my notes and I will look to publish something on that. Apologies that hasn't happened yet, but I will go and do that and let you know exactly the concrete answers to that in terms of what's known so far. I don't think there's a heap, but I will look into it again and re-look into it since I last did, to see whether or not there is more information that's come out recently about that, because that is obviously important. What about those in the dark matter? Grey matter, lesions in the grey matter, interesting, and probably now coming into light, pardon the pun, for want of a better word, because we're starting to get imaging techniques now that might be able to shed more information on that instead of just being able to look at the white matter. My easy answer to that, again, I need to go and look at the most recent information about what's known about the lesions in the grey matter and grey matter in general, is that there's a lot there that's important. There's a lot of information contained within the grey matter that we need to be looking at in terms of the exact effect that they're having and things like that. Yeah, there certainly has been some stuff on it. Again, I can do an article on it. There is information out, and we are, as I said, it's only sort of recently that we've been able to start to look at that a bit more. So I think it will be a really interesting area moving forward that we will find more and more about. Is my sort of answer to that. So just reading. So Cassie, I've got too many lesions to count. Neuro can't tell me how many I've got. I do have both left and right frontal lesions, having caused seizures and worsening memory. So firstly, obviously, thank you for sharing that information, and happy if anyone else wants to comment with that. The seizures is interesting, and I did have a private message a while back from someone who was interested in knowing more about MS and seizures, and whether or not MS, there was a link between MS and epilepsy, and that article's on the MStranslate website now, and I will link that article underneath because there was some interesting stuff on that. Certainly what is known is that people with MS do seem to have a greater risk of having seizures than the general population, but however, how great that risk is and how much greater that risk is in people with MS is sort of varies between the different studies. So yeah, and how that relates to, where the lesions are and things like that, important information. But we're sort of still coming to terms with that. So that link is now there for anyone who does want to read that summary about link between MS and epilepsy and seizures. If you've had seizures as part of your MS, feel free to comment below, because there are people who are interested, people in our community who are interested in knowing more about that. So yeah, feel free to comment with that below. Just reading through some other comments as we go through, just making sure that I'm up to date with all the questions that have come through. I think I am so far, so I'm doing all right. Yeah, so there you go. So yeah, another person, thank you for sharing that Marta. So it does, as I said, it seems to be certainly something that's more prevalent in people with MS than the general population, the risk of this. So if you want to know more, I've posted the link. There is a bit more detailed information in that about what's known so far. So if you are interested, read that summary. We'll give some more information. If you have any questions about it, feel free to ask. For people who may have just started watching, I can see that we still have a lot of people watching along. So welcome if you're newly watching. If you haven't participated in one of these before, I better go right back to the start. If you don't know who I am and what I'm doing, my name's Brett. I'm one of the co-founders of MStranslate. I have a background in multiple sclerosis research and now do all of the science communication work for MStranslate to break down MS research into a way that's independent, accurate, easily accessible, but most importantly, easy to understand for you guys so that you can stay on top of everything that's happening out there in the multiple sclerosis research world. And occasionally, I do these Facebook Live videos to come on and interact with you guys and answer questions, and any questions that you might have about things that you've seen in MS research, or really anything at all that you want to ask about or provide feedback. So if you have just jumped on board, all you have to do, post those comments, post those questions or comments below the video in that comment section. You'll see a bunch of them already there, and they will pop up in my screen, and I will make sure that I respond to them. A couple of other, and Leanne's just said, I think there are quite a few people with MS on epilepsy medication. Yeah, and again, you guys, this is certainly an area that you guys will be more capable of answering than me, potentially. So if there are people on epilepsy medication or have experience with seizures or anything like that, feel free to share your experiences, because I'm sure there are people in our community who would love to hear it. We know that hearing from other people is as much as people like hearing from me. I'm going to assume people like hearing from me if you're all on board and you're still here after we've been going for a while. But they really do appreciate getting to hear from other people in the community as well, who have similar experiences, because we know that one of the things with MS that people often feel a lot is a feeling of isolation. We hope that MStranslate provides a sense of community and that you all feel part of something here. But being able to hear from other people can really reduce that sense of isolation and make people know that they're not alone with the things that they experience. So definitely, not only here, but at other times, feel free to share those experiences as we go through. So Tracy, welcome. Thank you for joining us. So in terms of biotin, at the very beginning of this video, I talked a lot about biotin. The video will get published to our Facebook page later, and you can go back and watch that. But I will go through just quickly sort of summarize my earlier summary. So high dose biotin has been really interesting. There's been a couple of trials done on it that have suggested that it can have benefits. One of the big trials was done by Medday Pharmaceuticals with their compound MD1003, which is a high-dose biotin formulation. In the larger trial that they did, they found that a small group of people with both secondary progressive and primary progressive MS did show benefits and reach the endpoint. It was only a small percentage of the people who did take the high-dose biotin. They're trying to work out what about those people meant that they responded and others didn't. Late last year, their application to have that compound approved in Europe was denied due to what the approval agency said was a lack of convincing evidence at the moment. They've gone back to try and increase the amount of evidence that they have for its use. I've posted a link in the comment section here to an interview we did a couple of years ago with the leader of that trial, so you can watch that. One of the head researchers on that give you more information about that trial that they did. And yeah, once this video is published, after we're done, you can go back and watch the start, and I do talk a little bit more about it, but those are the big points at the moment. We've also heard some anecdotal evidence on biotin from members of our community who have said that they've found it beneficial. Other people haven't. So it seems to be that could be in the same boat as other MS medications. Some people find benefits, other people don't. No worries, Tracy. Hope that helps. Cassie, to put this in a slightly ironic way, you certainly aren't in isolation in feeling isolated. I think that we do hear that a lot from members of our community. It's a very common thing, and we hope, as I said, I really hope that MStranslate provides a place where people feel like they are part of something, that the MStranslate is like a big family. We do when people need help. We do try and rally around. We try and answer questions to help reduce confusion, because obviously confusion can be a real big source of isolation. Sharing personal experiences. We do want to do more of our MS Many Stories pieces, so if you are a member of a community and you've had an experience that you want to share with other people, please do get in touch. We would love to be able to share those stories. But MStranslate, if anyone is feeling like that, MStranslate is always here, and we're always wanting to chat and talk and do all of that sort of stuff. So hopefully that helps. Brendan, welcome. Thank you for participating. Brendan again is someone who has participated in a number of these previous events, so it's great to have you back. Thank you for your participation. So what's the expected time between mouse models and actual patient availability? We see a lot of research outcomes reports, but there is a lag to market. Yeah, definitely true. And that's why with a lot of the summaries that I do, if they are done in mouse models, they make a real big point at the end of these articles of saying this is a mouse model study, which means, one, there will definitely be a lag, because between mouse model studies, there's generally quite a bit of extra work even out of those before we get to clinical trials. Then once we get to clinical trials, we have a phase 1 clinical trial, which is generally done in healthy individuals just to measure the safety of it. Then we have phase 2 clinical trials, which is done in a small cohort of people, again to check the safety and to get the efficacy and to see is there enough benefit from this that we want to take it to a larger trial. Larger trials then are phase 3 clinical trials. These tend to be the big trials that have a lot of people on them. And then occasionally we'll have a phase 4, which is sort of more a real world outcome, longer, larger trial. The time lag of that can vary, but it's years. But the reality as well is that, that's also best case scenario. And I don't know if unfortunate is the right word to use, but the unfortunate reality is that lots of things that are effective in animal models or mouse models of MS never make it to human trials or aren't effective in human trials. It's sort of this funnel between what we see as effective in mouse models through to what actually makes it to market, is quite small. Mouse models or animal models are great because they're really important to give us this starting point. But it's just a model of multiple sclerosis. It sort of mimics the disease. It's not exactly the same as the human disease. And so, things don't always translate across into the human disease. And even if they do, they don't necessarily then work as well, or there's issues with trial designs that can also hold things up, working out the best ways to formulate the drug, the best ways to store it, the best ways to provide it to humans is the best way to do it as an injection or, intravenously or in a pill. All of these questions are still things that need to be answered. If you've ever watched interviews that we've done with Dr. Travis Stiles from Novaron Bioscience in San Diego before, a great supporter of MStranslate, he talks a lot about that process and how important it is to create a treatment that's going to get the best effects. And so all of these things are really important. It's years between a mouse model and getting something that's effective and then getting approval. In terms of, how quickly approval might happen, again, depends on the specific therapy that we're looking at. If it's something that's really meeting an unmet need, it can go through quite quickly. It can be what we call fast-tracked. Other times it can take longer if they need to build more and more evidence. So it is, while there's no exact time frame, it is a really important point that you bring up, that we need to be hugely aware of mentioning that when we talk about treatments and studies, that we don't talk about things that are done in animals in a way that makes it seem like this is going to be life-changing for people in the next year, because there is quite a delay as you say, as well as the fact that it may not ever actually make it to market because it doesn't work when we take it into humans. So yeah, fantastic question. Hope that answers it. Kathy, have you had any further updates on Travis's remyelination work? I wonder if Travis is watching. What time is it? No, Travis does do weird hours, but no, I doubt Travis is watching at the moment. Otherwise, I would get him to comment himself. No huge updates recently in terms of new findings that are coming out from it. But Travis and I are in constant contact. We may be able to share some interesting news from Travis in the near future. I do know that as soon as there are any updates from it, Travis will be ready, willing, and able to share it with you guys. He is very passionate about making sure that this information gets out to the MS community. We've at length, Travis and I have at length talked about doing a whirlwind speaking tour around the world where we travel from town to town and talk to people about MS research. It's sort of the Batman and Robin of MS research science communication. We haven't yet decided who's Batman and who's Robin. But Travis will definitely be interested in providing updates and talking to you guys if and when they happen. We still do talk regularly, so that will happen at some point. I was going to say something else about that. What I can say in terms of updates from people you might have heard from before, we're hoping that we will be able to, and this came up in a recent discussion that we had as well. Another person that we're talking to a bit at the moment is Dr. John Creasel from the University of Utah. You may remember we did a feature with them a number of years ago, looking at human endogenous retroviruses and how they might be involved in MS. I know that he has some updates. He'll be sharing them shortly. We're hoping that he will come on and share them with MStranslate. We don't know exactly what form that will take yet, but I know he's keen to talk more, and I'm hoping to have that conversation with him in the near future. I know it's an interest area for you guys, so we'll be pushing to get that information out in the best format that we can. So stay tuned when it comes to that. So Cassie's just said, I've recently heard of brain transplants. Can I please order one full of myelin? I have not heard, surprisingly, that I'm not saying if that's. I would be really interested in seeing any research or stories on that at the moment. It would be really interesting to see if that is being. I'm trying to think about how that would work. I would be interested if that's happening. Doesn't really make sense in my head at the moment. But look, if there's information out there on it, as I said, send it through, and I'd be happy to give my opinion and my thoughts on it. So certainly send that through. If there will certainly, the queue for mine would be non-existent. That is what I can say about that. But I haven't seen it, so feel free. If you've got some information, feel free. Yeah, if you can find where you heard it or where you read it, please send it through, because I would love to read it, but I haven't seen anything. If anyone else that's listening has seen that, feel free to send me that information. I would be very interested to read it. As I said before, that applies to anything that you might read online. I think I've said before, when I've sort of gone and given talks out to people, especially my sort of every morning for me starts with, I read PubMed updates, so I read everything that's been published over the past sort of 24 hours on multiple sclerosis, just see the scientific articles that have been published. And I go through the Google alerts to see what's appearing more in the mainstream media about multiple sclerosis. Joked before about which one I should read first, because often the Google alerts can concern me a bit with some of the stories, like the ones that I talked about earlier in this, in terms of misreporting of facts. But even with those things, there is so much being published and so much going on that I miss things. I can't stay on top of everything. There was something like 4,000 research papers published last year on MS. It's impossible to stay on top of it all, so feel free to send through anything that you do see. I'd be happy to read it. So James has asked, what's your view on MS being hereditary? So MS, in terms of how we generally talk about it, there is certainly a genetic component to it. So we know from studies that have been done, especially on monozygotic twins, that these have indicated that there is a genetic component to it. More recently, with all of the different genetic tools that are now available, there's been something like 160, sort of last count, variations of genes that seem to increase a person's susceptibility to developing MS. Now, these have different levels of effect. Some increase the risk quite a bit. Some have a really small effect in terms of how much they increase the risk. A study has shown that this is also additive. So the more of these different variants you have that increase your risk, they add together and increase your risk more. So it's, if you have 10 of them, that will add up compared to having a couple of them or one of them. But we know that MS, in terms of the way that we talk about it, generally, it's not a hereditary disease. It's not a classic genetic disease in that, if you had two parents who both had MS, the child wouldn't necessarily get MS, which we would expect. If it was... It's not 100% true in terms of how we always think about it, but it's not that sort of genetic disease where you can see it pass through that obviously and you can go, okay, that's a genetic disease. There are certainly environmental factors that also come into play, and what those environmental factors are and how they interact with the genetic components, we're still not 100% sure. We know that things... there's hints that vitamin D might be involved, and for a long time we've known that the closer you live to the equator, or the closer you grow up to the equator, because it seems to be age dependent, so it's the first years of your life that are important in terms of this risk. The closer you live to the equator early in life, the lower your risk of developing MS. The further away you are, the higher your risk, to the point of people who grew up in Tasmania 7 times more at risk than people in Queensland, for example. So that's been linked to, is it sunlight exposure, potentially vitamin D, infections, smoking, all of these different things, seem to be playing a role. It's a difficult question to answer. So it's not, in terms of, there might be slight variations of MS, and there was a study a while back talking about a familial form of MS that appeared to be due to a genetic mutation. That's since been disproven. It's not really been the case. But certainly in terms of classic MS, it's not hereditary in terms of a classic genetic disease. There is a genetic component to it. And obviously this comes up a bit in terms of people if they're thinking about having kids. Will I pass on my MS? No, not in that instance. As to how we would talk about it, you might pass on a bit of a risk factor, but you can't pass on the disease like that. So hopefully that answers that question. Brett, can I please ask why you have a passion for MS study? You can definitely ask, and it's a question that I do get asked a lot. And you would think, having been asked it a lot, I might have a really good answer for it. I guess the two common things that people assume, a lot of people sort of assume that I might have MS, and that's where my passion comes from. I don't. That's not That's not where it comes from. Other people will assume that it's because I have a close relative or friend with MS again. Previously, when I got into this, that wasn't the case. It certainly wasn't the driving force. Obviously, now I have you guys, the MStranslate community, which is certainly a huge motivation, and all of the people that I get to meet and talk to and support MStranslate, are constant motivations to keep pushing, keep trying to find answers, keep making sure that the research that we get comes out to people. But those weren't the driving factors initially. I had a background in undergraduate at uni looking at immunology. That was sort of what I was interested in. Autoimmunity was always of interest because the immune system is such a beautifully constructed system in a way, in terms of how it can respond to so much variation in bacteria and viruses to protect us from all of these different infections, that how it can go wrong was interesting to me. I started doing a research project on that in my honours year, and I got a scholarship from MS Research Australia to study that. That went on to then do further research into it. And really, since then, it's just something that's grown and grown and grown. Even since I've sort of stepped away from the research bench a bit more, it's something that I feel really passionately about for a number of reasons, really. Certainly this, and having the MStranslate community is a big one now. One of the things that you don't get when you're doing research necessarily is you don't have the faces to put with what you're working on. And having that now and having met people, there's not even a question now of being able to stop. There's too many people who, want to help. So that's a big one. But also, and I'm sure I've said this before when I've given talks, it's part of the way that my brain works. MS is a big puzzle, and it's so different to everything else. We have these things that are very clear cut in terms of you get this infection, you get this illness, everyone kind of gets very similar. You get the flu, you get the same sort of things. You get the cold, everyone gets the stuffy nose, starts to cough, all of these sorts of things. MS is just such a different ballgame. We still don't know what causes it. There's probably a combination of causes coming together. Even with that, then how people progress with it is so different in between individuals. It's just the way my brain works in terms of that. I can't switch off that puzzle. I think I've said recently as well that I will be lying awake at night just thinking things through, and ideas will come to me, and that sort of stuff. So that certainly is part of it for me. Part of the way my brain is wired, the puzzle aspect, the fact that I can't switch off from it. You guys, it's all of these different things that have come together, and now I just want to keep finding answers and helping people find answers from what we do. Be it you guys finding answers to questions, helping researchers in the job that they do, because it's not easy being a researcher. I am more than happy to put that out there, that research is difficult. The research climate is getting harder and harder, and so it's anything that we can do to help that. Something again that I feel passionately about. So one of the things that we've started doing this year, Cassie, is we've started looking to help try and obtain funding for research projects that otherwise wouldn't take place because the funding's just not there, and it's getting harder and harder to get funding for projects. And if we see really high quality research that can make a real difference to people living with MS, we want to make sure that research happens. So we're now starting to try and help that. So we have our first projects up on the website now that we're trying to get community support to provide the funding for that. I talked recently to a group about this, and I think one of the big things to state with that is that we don't necessarily expect people with MS to be the ones that are providing the funding for it. What we sort of ask, and what I've been doing, is if you read about the project, you hear about the project, and you think that it's important research, and you think that it could provide really important outcomes for people living with MS, be advocates for it. Go out and talk to people in your community. Go to local businesses and say, look, this is something that could really have direct impacts to our lives, and we need this research to happen. Can you donate $10? Can you donate $50? Can you donate $100? Just being out there in the community and being advocates for research and getting them to support it. If everyone in our community did that, I did the numbers in my head when I was giving this talk, but if everyone in our community did that and managed to convince 5 people to all donate $10, the project would be funded really quickly. So that's certainly something that I feel passionately about now, as well as trying to make more research happen and help the researchers out, because I think that's really important as well. That's certainly another way that I think where we can help. So we're getting close to sort of 2 hours of doing this. I can see that there's still some people watching. I can see that the numbers are starting to go down a little bit. It's obviously getting quite late here in Melbourne, late in Australia. I'm sure it's late in other parts of the world. Unfortunately for our North American people, it's the middle of the night there, that they might start to wake up soon. Obviously, if anyone's watching from Europe, hi Europe. It might be a good time for you guys if you want to ask questions, but I will take a couple more questions, but if there's sort of nothing more, we'll finish up shortly. I think with how successful this has been tonight, the feedback I got on the recent video, I will just try and do these more often. I love doing them. I really enjoy them, so we might just make this a regular thing. So again, as I said earlier, if there are times that are better, that you would prefer to be logging on and doing this, let me know. That's especially for people who might watch this back when it's replayed. If you've managed to get through an hour and 53 minutes of the video to get to the point where I'm saying this, congratulations, because that's a fair effort. Certainly, feel free to watch it through in installments. I don't know that many people could stand to listen to my voice for an hour and 53 minutes. If you've been here I will stop and say, if you've been here from the start and have watched this whole thing, you're amazing. Thank you. But yeah, certainly, let us know any of that sort of feedback, because I enjoy doing it, and the feedback that we've got tonight's been fantastic. So I'll certainly look to do that more often. As I said, Tracy, my pleasure. There are lots of people like me that exist. Trust me, that they're out there. There's lots of people who are passionately working to do this. I feel really fortunate in the fact that I get to be one of the faces that gets to do this and gets to actually talk to you guys. I feel pretty lucky to be able to do that. So, but there are lots of people working tirelessly to find answers, and we're getting there. So Cassie, I will post the link. So there's this specific project that I'm talking about. I will post the link to that in the comments section in 2 seconds. So on this page, you'll be able to see information about the project. There's some videos that were filmed with the researchers involved, talking about what it is, how it works, what the potential outcomes are. We'll be doing more of that. We'll probably do a Facebook Live video with Thomas to talk again more about it, because the big thing for us, in terms of if we were going to support research in this way, was that the researchers would be committed to coming on board and talking to you guys about the research and directly communicating about it. So that's a big thing. So there'll be more of that. Support MS Research Project. Sorry, just post the link to that. So you'll get all that information on there. You can get it through that link. Then to actually be able to donate, or to, if you're encouraging other people to donate, at the top of that page, there's a button that says contribute. You just click on that. It will take you through to a University of Melbourne page, which is where you can donate towards that research. 90% of that funding goes directly to this research. The other 10% goes to MStranslate to help support us provide the updates. So that just covers our costs in terms of providing you those videos and the updates with them. So other than that, none of that money goes elsewhere. 90% directly into that research project, 10% to MStranslate to help communicate not only about that study, but about all of the other stuff that we do, because essentially we almost completely unfunded for all of this MStranslate stuff, so it helps us just in a little way of being able to keep doing this. So you go through to that, all of the donations through the Melbourne Uni page are completely tax deductible as well, so that's how you can do it. If anyone wants to ask any questions about that, feel free to contact me. You can send me an email, contact us through Facebook. I'd be happy to talk more about it for anyone who needs more information. That's that bit done. Kathy, I will have to stop. The battery is going to give out on me soon, and I need to make sure that I upload the video before that happens. So I'm going to make this the last question and then say my goodbyes. CCSVI. Yeah, I can explain a little bit about CCSVI. It's obviously a really difficult topic to talk about. I've done some videos on it before. I did one of my last Facebook Live videos before that. I gave an update on the recent trial results. Here's my really quick summary on it. So CCSVI is about widening blood vessels in the neck that may be blocked in people with MS that may provide benefits. So it stemmed from an Italian doctor that treated a person he knew, saw benefits, went on to do it. Since that, the results have been controversial and quite divisive in the MS community. Some studies have shown, said that this is present in a lot of people with MS, and fixing it can provide benefits. Others have shown that it's in very small numbers in people with MS, doesn't provide benefits. The most recent trial results done by the guy that did it originally was published as saying, he came out and said, look, no, based on these trial results, we can't say that there were any benefits to this treatment. So that's where it's at the moment. With that, I will say that they didn't actually improve the blood flow in a certain percentage of people that had the blocked. So that seemed a bit strange to me, that possibly the treatment wasn't working. So whether that affected the treatment outcomes, there's been suggestions that, part of it was about that maybe it wasn't clear in terms of what they did. I have looked at the study results. Again, that other Facebook Live video that I did goes into a bit more detail because I had the paper in front of me with it when I did it. I'd have to re-look over it to really summarize their data again. Hopefully that explains it a little bit. As I said, if you're interested in knowing more, comment again under this. I can do some articles on it, but that's sort of my brief summary of where it's at. So with that in mind, I will call it an evening there, unless, if you bear with me for 2 seconds, what I might be able to do, so that I don't have to jump off super quickly, let me just see if I can get this in so that, just bear with me, not in any easy way can I, with the way this is set up, get the charger into that. So apologies with that. I will call it an evening now. We will do another one of these shortly. Thank you very much for everyone that's participated. Thank you for all of your questions, all of your comments, all of your positive feedback. It's been amazing. Really appreciate everything that you guys do for us. So thank you again. I'll do it again soon. If you want to comment with anything else underneath this for questions for the next time or to answer in the meantime, please do. Enjoy your evenings or your mornings or wherever you are when you're watching or whatever time you're watching it. Thank you again. It's been a pleasure. We'll talk soon. Thank you.